Now, almost 3,000 people died in what's been called the worst scandal in the history of the NHS. It started in the 1970s and 80s when patients were given blood contaminated with HIV or hepatitis C. Despite repeated allegations of a cover-up, it's taken until now for a public inquiry to begin. The opening day heard that for too many victims, the infection took away life itself, while hundreds more were robbed of their dreams, their hopes, their dignity and their sanity. Our health and social care correspondent, Victoria MacDonald, reports.
My father died of a virus that I couldn't speak about, a virus that I couldn't tell my friends because of the stigma.
I don't know, to lose my son was just terrible.
Some of the thousands of people infected and affected by tainted blood. A montage shown at the opening of the inquiry into what has been described as the worst tragedy to hit the NHS. Testimonies were read out.
I went from having everything to having nothing really overnight, not even really having a future, because I was told I only got 2 or 3 years to live. Go away, make your will.
Hundreds attended the first day. This is a UK-wide independent inquiry, and it will look at why blood products meant to save lives cause so much harm. Some were wearing red for HIV, yellow for hepatitis C, and black for those who've died. Katie Walford and her mother Rhiannon Hatton, they were left fatherless and widowed after David Hatton died from AIDS.
Seeing everybody here today and seeing everyone united is just a fantastic feeling.
It's obviously very emotional for both of you. It's ridiculous. Well, it's not ridiculous because we've still got something to say and justice needs to be served. It
and
really
not only
does.
that, we need to make sure this doesn't happen again.
Yes.
I don't want another 10-year-old girl to have to say goodbye to her dad.
It has taken at least 3 decades to get to this point and has been a long and bitter battle. And the inquiry itself is expected to last for at least 2 years, taking evidence from families, victims, governments, police, health officials, to name but a few. And not just those with haemophilia, those infected from transfusions or as it was passed on by a loved one.
It is hard to underestimate the importance of this inquiry for all those people now inside, the families, and for those who were infected with this tainted blood. In fact, you only need to look at the terms of reference and you'll see a section in which they ask, is there evidence that medical documents were destroyed or that information was withheld? In short, was there a cover-up?
Rosamond Cooper was infected by factor VIII, used to clot the blood of those with bleeding disorders. She contracted hepatitis C, and the treatment to get rid of that left her unable to work or have a family.
I want the truth. I want all this stuff that we've had rumours about, that people have said, oh yes, there's this, there's that, this happened in 1953 or 19...
But what if it didn't happen? What if they find that those rumours were in fact a lie?
Just lies. Well, then it is what it is. And it will still be an answer, won't it? It'll still be the truth. Whatever the truth is, I want it to come out.
A central question will be who knew about the factor VIII imported from America in the 70s and 80s, where the blood had been donated by, it turns out, infected drug users and prisoners.
The principles. The inquiry will put people at its heart, UK-wide. It will be as fast as reasonable thoroughness will permit. It will pay proper respect to persons' entitlements to be heard. It will be as open and transparent as it is legally possible to be. It will be independent of government and frightened of no one in the conclusions it draws.
There have been other inquiries, Penrose in Scotland, which cost £12 million and made one recommendation. It became a bonfire. And a private inquiry led by Lord Archer that did not have powers to force attendance.
It is too late for some people, but for those that are still living and for their families, it's imperative that this inquiry is robust and it's effective and it is open and honest and transparent.
And indeed, even since the inquiry was announced by the Prime Minister last year, more have died. But it is a testament, perhaps, to the human spirit that some of those here today were at least cautiously optimistic they will get their answers.
Well, with me is Andy Evans, a haemophiliac who was infected with HIV after being given contaminated blood when he was just 5. Andy, you were at the inquiry today, weren't you?
I was, yeah.
What effect did it have on you?
To be honest, Cathy, it was a rather surreal experience after, having been infected for more than 30 years and for campaigning for probably more than 20 of those. This is a day that I never thought I would see. As much as I wanted to campaign for and keep fighting, it is a very surreal event. We never thought we'd get here, and here we are today at the opening of the Infected Blood inquiry.
And did you feel a sense of relief about that, or how did...
So many emotions. I mean, there were so many people there that I'd never met before. I mean, a room absolutely filled with people infected and affected by this. Really brings home the scale of the disaster. For me personally, I think what the inquiry has done just today is to make it an official thing that people can own. They can now come forward and they can say, yes, I was affected by this, and here's something I can hang it on now.
After all these decades, I mean, what for you does the inquiry need to establish? Who does it need to hold to account?
For me, it has to look back to, first of all, the decision makers who took the warnings of the infected products in the beginning and either ignored them or swept them under the carpet. It needs to hold medical professionals to account when they decided that they were going to test people without consent and then withhold those test results from people. And it has to hold the civil servants to account that have really swept this under the carpet for the last 30 to 40 years.
And only then can those who have been victims of this scandal get proper compensation, is that right, rather than the small sort of ex gratia payments that you've been getting?
I think so. I think once we've got the final truth of this, Andy Burnham made this very good point.
The Mayor of Manchester.
The Mayor of Manchester, when he was still an MP, he said, what you have to do is to find the truth. Once you've found the truth, everything else can follow on from there. But you need that truth and you need the British public on side. And he had a point. I think, once we establish that truth, then the justice and then the compensation and the support that people need can come forward.
And the inquiry was told today that half the people with haemophilia who were infected have now died.
Yeah.
I mean, why has it taken so long, do you think, to get to this point where you've got a public inquiry?
I think when you compare it to other disasters, when you talk about, let's say, Hillsborough, the terrible tragedy that was Grenfell, these are events that you can pin down to a couple of hours or a day or a couple of days. They're physical, you can see them happening, you can follow them on the news, you can point to that and say, yes, that was horrific, these people died because of this. Certainly with contaminated blood in the beginning, HIV had such a stigma attached to it that those who were affected were frightened to come forward. And that's been maintained as well with hepatitis C over the years. And so this has been rumbling on now for 30 years. There's no definitive point that you can say, actually, this is when it happened. There's no comparison with other tragedies like that. And that's why it's rumbled on for so long. And that's why it's been so easy for the government to say, this isn't an issue.
You have lived with this terrible tragedy since you were 5.
Yeah.
Just give us a sense of the kind of toll that it's taken on your life throughout all those years.
Yes, I was infected when I was 5, and my parents knew when I was 9. They didn't tell me till I was 13, but the reason they told me was because I was developing symptoms for AIDS, and I was diagnosed as having full-blown AIDS when I was 16 years old. There were no treatments for HIV around at that point. This was before combination therapies. And so it was a very scary time, both for me and my family, and for a lot of other kids who, grew up with haemophilia, that were at the Children's Hospital with me, who stopped coming in because, to be frank, they died from AIDS. And we didn't know what was happening, and people were dropping like flies. But then, having it catch up with me and having AIDS for roughly 4 years before the combination therapies came out, that's your most formative years just gone. And you find yourself almost a social outcast. All of your social circles have moved on around you. and you've got to try and rebuild a life from scratch again. It's really quite difficult.
Andy Evans, thank you so much for coming in and talking to us today. Thank you.
Thank you, Cathy.